Hello, my name is Cameron. This is a fall prevention and nursing leadership presentation by myself and Eric Diaz. So our area of interest was nursing leadership and fall prevention. So we wanted to focus on fall prevention because hospital falls are some of the most common preventable injuries that cost hospitals millions of dollars. And leadership must take an active role in preventing these falls in order for it to get processed on the unit and create a culture of safety. Leadership's role in safety, nurse leaders must set the example by encouraging teamwork, accountability, and through the use of fall prevention practices. In order to implement evidence into practice, leadership helps implement the research into practice through programs like fall tips to help improve patient outcomes and reduce falls. The importance is fall prevention helps to improve patient satisfaction, meet hospital goals and standards, and provide high quality, cost effective care. The impact of falls on healthcare outcomes. So there's a prevalence and risk. Hospital fall rates range from 3 to 12 per thousand patients per day. There is a 25% result in injury and a 10% result in extended hospital stays. So this is a poor patient outcome. Patient safety and quality of care. We want the falls end up resulting in um, increased morbidity, fear of being in a hospital, reduced independence, patient satisfaction, and increased recovery time. So, organizational and financial burden. This is what is going to be put onto the hospital itself. Each patient can, each patient's fall can add up to $35,000 in costs and non-reimbursable expenses. This can affect a hospital's financial sustainability. The policy and accreditation. Fall rates are vital in measuring performance for national reports. They help in deciding reimbursement and accreditation, so preventing falls is vital in order for hospitals to get certain funding or even certain recognition rewards. The impact of evidence-based practices on fall prevention. Through the implementation of the Fall Tips program, falls were reduced by 19%, and hospitals have been able to avoid almost $14,000 in cost per 1,000 patients per day. Hospitals are using multiple interventions that rep- Hospitals that are using these interventions reported a 30% decline in falls that caused harm, which in turn increased patient safety and hospital reputation. Nurse leadership is able to use data tools to keep track of fall numbers, manage resources, and plan budgets according based on results. The evidence of the evidence-based fall prevention programs where hospitals are rewarded for safety outcomes have helped to reduce injuries and prevent costly hospital stays, and it also encourages staff to be participating in the fall prevention program. In order to get a better idea of this, we like to put it in a Christian worldview. So, respect and care of our patients. Our Christian worldview teaches us that every person has an inherent value, and nurses can show this by protecting patients from harm through fall prevention and caring for their health as a sacred responsibility. Serving others through leadership. Leaders who follow Christ's example lead with humility, kindness, and compassion. They focus on helping others to create a safe and supportive environment. Doing what's right for safety. Faith-based leaders connect their values with nursing practice. This in turn helps them to make choices that protect their patients through the use of compassion and evidence-based practice. Faith builds strength and hope. Christians' beliefs help nurses to stay strong and hopeful among care teams, which reinforces their commitment to improving care. Leadership practices and principles in fall prevention. A transformational leadership is going to encourage nurses to work towards goals and help with adaptation in new policy implementations. Evidence-based decision-making is incorporated through the use of data analytics and ongoing evidence-based practice research. This allows leaders to implement cost-effective fall prevention practices through their units and have something evidence-based in order to um, make sure that they're implementing it in the right way. The interprofessional collaboration. This is where leaders should have open discussions with nurses, physicians, physical therapists, and occupational therapists in order to make tweaks about their unit to better implementation of fall prevention practices amongst different units. The continuous education and mentorships. Uh, when leaders are able to promote internally through promotion of education or the use of mentorship programs, this allows nurses to want to stay in it and prevent quick turnaround rates. That way, they can excel in fall preventative care plans. There's challenges leaders face in fall prevention. So there's resource constraints. This is a lack of resource nurses, insufficient staffing, responsibility overload. This can contribute to nurses taking shortcuts and preventing falls. Um, the variability across units. So Turner explains how inconsistent management can lead to a lack of application of prevention strategies across multiple units. This is especially when used in a nurse that is a float or a per diem or travel nurses. With every single policy change, there's resistance to change. New nurses or veteran nurses can have a resistance to changing the way that they practice, especially when workloads are high and staffing is low. So, in order to do this, sustaining engagement is also a really big problem because the lack of participation can spread across the unit from nurse to nurse. And programs require continuous feedback, recognition, and assurance of implementation for management and peers. Knowledge and insight gained from research. Integration of evidence-based interventions. So research shows that a combination of multifactorial interventions along with patient education programs lead to a substantial reduction in hospital falls. The role of the leadership consistency maintained from a leadership perspective shows that through the use of evidence-based strategies, this can combat staff resilience and engage staff more to participate in updates. The impact of patient engagement. Safe Recover Initiative program highlights that educating and motivating patients leads to better patient autonomy and outcomes, and the value of continuous evaluation. Nursing leaders need to use consistent data analytics to create a reflective practice that assesses outcomes along with providing room for adjustment of safety protocols to fit the unit's dynamic. The application. Implementation of education programs, so through the use of safe recovery or fall tips, these programs can promote engagement. Mentorship and team empowerment. This further promotes nurses to nurse champions, and mentorship roles reinforces adherence to evidence-based fall prevention strategies. The policy and system alignment. Having fall prevention goals with institutional policies and metrics enables leaders to be more knowledgeable and attentive to accountability. Continuous quality improvement. This is having a regular audits that allows for leadership to be held accountable on making sure that their unit is accountable, and this promotes a reflective workplace. So advancing safe and compassionate care, we want to look at the synthesis of evidence and leadership. So through consistent evidence-based practices and leadership engagement, patient safety is improved by a reduction of falls. The ethical and humanistic commitment. We prioritize a compassion-rooted leadership because this sets an example of care that should be carried out from the healthcare workers to the patients. Empowering teams for change. The transformational leadership fosters accountability, continuing education, and a culture of safety that makes a huge impact on outcomes of patients. And the vision for future practice through integration of better technology to aid in body mechanics, education, and the metrics incidence of falls that the acute care setting are projected to decrease. Thank you very much.